I will be calling Sir Keir Starmer and welcoming him in his first outing to this dispatch box. Keir Starmer.
Thank you, Mr. Speaker, and can I thank you, the House authorities and the staff for allowing us to meet in this way today, because it's important that we have this scrutiny. Can I also send all of our best wishes through the First Secretary to the Prime Minister for a full and speedy recovery. And I'm sure I speak for the whole House in sending our best wishes to all of those affected by coronavirus, and condolences of the whole House to all of those that have lost loved ones. And again, for the whole House, our deepest thanks to those on the front line risking their lives to keep us safe and our country going. Mr. Speaker, I promised that we would give constructive opposition with the courage to support the government where that's the right thing to do. And we all want and need the government to succeed in defeating coronavirus. But we also have to have the courage to challenge where we think the government is getting it wrong. And in that spirit, I want to start with testing. Testing is obviously crucial at every stage of the pandemic. But we have been very slow, and we're way behind other European countries. Now, the Health Secretary made a very important commitment to 100,000 tests a day by the end of April. But yesterday, the figure for actual tests was 18,000 a day, and that was down from Monday, which was 19,000 tests a day. So we're way behind the curve, and the end of the month is a week tomorrow. So what does the First Secretary expect to happen in the next 8 days to get us from 18,000 tests a day to 100,000 tests a day?
First Secretary.
The right honourable gentleman, congratulate him on his success being elected leader of the Labour Party. I will certainly pass on his best wishes to the Prime Minister. I know he would want to be here in person. And can I join him in paying tribute to all of our NHS and other frontline workers? He rightly raises the crucial issue of testing, which is going to be an incredibly important part of our strategy for transitioning from the current social distancing measures. But I do have to just correct him. Our capacity for tests is now at 40,000 per day. So I think that is an incredibly important milestone. And of course, he's right to say that in the final week that will require a big increase. But of course, with a project like this, it does require an exponential increase in the final days and the final week of the programme. I can reassure him that we are working with a range of commercial partners to boost the testing to get to that 100,000 tests per day. 2 of our super labs in Milton Keynes and Alderley Park are now fully functional, and Glasgow will be open later this week.
Keir Starmer.
Thank you very much to the First Secretary, and thank you for his kind comments. I didn't need correcting because I gave the figure for the actual tests a day. The First Secretary says that there's capacity for 40,000 tests a day, and I think it's really important that we fully understand what the First Secretary just said, because that means that the day before yesterday, 40,000 tests could have been carried out, but only 18,000 tests were actually carried out. Now, all week, I've heard from the front line, from care workers who are frankly desperate for tests for their residents and for themselves, desperate. They would expect every test to be used every day for those that need them. So there's clearly a problem. Why isn't the government using all the tests available every day?
Secretary.
I thank the right honourable gentleman, and it's important to pay tribute because there are 2 elements of this. Getting the capacity up is part of it, and we're making good progress, and I hope that he has conceded that point. The issue of then increasing the demand is something that we've got control over. Of course, we're making sure that the eligibility is broadened. Our focus, as I think he would agree, should be on frontline NHS staff, broadened out to care workers and other key workers, and then done in a way which the system can manage. We are confident that based on our test capacity that we will be able to deliver that, and we have in relation to the capacity itself and getting to the 100,000 target, a range of deals with Thermo Fisher, with Randox. We've got the AstraZeneca, GSK and Cambridge University working together to set up a new lab that we will deliver. And those tests will be crucial, not just in terms of controlling the virus, but allowing the country to move to the next phase.
Keir Starmer.
I'm grateful and I welcome the fact that capacity has gone up. But it's not now a question of driving up demand. Demand is there. Last week, the Health Secretary said that every care worker who needed a test would get one. But the reality on the ground is very different. And there are very few tests indeed. And the position is this. If a care worker has symptoms of coronavirus, or a family member has symptoms, he or she has to self-isolate, quite rightly. To get a necessary test, they're then instructed to travel to a testing centre, which is often very many miles away. So an example is social care workers in Leicester are being told to go to the outskirts of Nottingham, a 45-minute drive, in order to get tested. There are lots of examples across the country of this. Now, there's an obvious problem with that system. Not all care workers will have access to a car. Because they've got symptoms or family members have got symptoms, they obviously can't use public transport, so it's little wonder we're seeing these pictures of half-empty testing centres. So it doesn't look like that's a good plan. And it's not about driving up demand, it's about tests where they're needed. So what reassurance can the First Secretary give to care workers on the front line that things will improve for them and fast?
Secretary.
Honourable gentleman, it is certainly about capacity. I've addressed that in my earlier answers and also explained how we'll bridge the 100,000. It is about demand. We need to encourage those who are able to take the test to come forward. But he is right. He is right to say it's also about distribution and some of the logistical and, frankly, transport challenges that people, particularly some of those that he described, will have in terms of getting to the test. So we're working with the local resilience forums to make sure that we can distribute the tests as effectively as possible. We've got mobile labs to go to some of those areas for the hard-to-reach. We'll be using the Army, who have made, along with the other key workers, an incredible contribution to support that effort. But I just come back to the key point. I do think it's important to have a target and to drive towards a target. We are making good progress. We're confident we'll meet it. And I think that he should join with me as we engage in this national effort of saying to Labour's Welsh Health Minister, Vaughan Gethin, who has abandoned the Welsh target in Labour-run Wales of 5,000, that actually we need to work together in all four corners of the United Kingdom to make sure that we reach that national effort. It is about capacity, it is about distribution. We'll only be able to manage to hit that target if all of us come together to deliver on it.
Keir Starmer.
Mr. Speaker, I do recognise how hard people are working to try to drive the number of tests up, but there is a significant gap and there's only 8 days left. Mr. Speaker, on Monday, Manjit Singh Riat, an A&E consultant at the Royal Derby Hospital, sadly died of coronavirus. He, I think, was the first Sikh A&E consultant respected widely across the country and instrumental in building up Derbyshire's emergency services. He's sadly just one of the many frontline health and social care workers to have died from coronavirus during this crisis. So can the First Secretary tell us how many NHS workers have now died from coronavirus and how many social care workers have now died from coronavirus?
First Secretary.
Well, can I just say to him that I entirely agree with the broader point he makes, which is that as our key workers, whether they're in the NHS, whether they're in social care, who are fighting for us, tending for the most vulnerable in our society, need the full support. That's why it's so important that we ramp up the testing, ramp up the PPE deliveries. On the latest figures, my understanding is that 69 people have died within the NHS of coronavirus. I don't have the precise figure for care homes. They're more difficult to establish in relation to care home workers as opposed to care home residents. But I think we can all agree in this House every one of those is a tragedy, and that can only double down our efforts to tackle this virus and do everything we can to support those amazing workers in the NHS who are delivering so much to take the battle to the coronavirus.
Keir Starmer.
I thank the First Secretary for giving us the figure in relation to NHS workers, and of course a tragic case, each and every one of them. I'm disappointed we don't have a number for social care workers, and I've put the First Secretary on notice that I'll ask the same question again next week, and hopefully we can have a better answer. Mr. Speaker, let me turn to protective equipment. Clearly this is crucial to those at risk on the front line who are risking their lives to save ours, and the least they deserve is the right protective equipment. And we've all heard countless examples of frontline workers not getting the equipment they need. This is an example from a Unison care worker just last weekend, and I quote, "I work in a nursing home. I'm terrified. I don't know if residents have a virus. We're wearing homemade masks. This is horrible, and I'm very scared." And that word scared, I think, is one we've all heard many, many times in this last 2 or 3 weeks. A survey by the Royal College of Nursing found that half of nursing staff felt under pressure to work without the levels of protective equipment set out in official guidance. This has been a stress test of our resilience, and the government plan is clearly not working. So can I ask the First Secretary to tell frontline workers at risk, when will they finally get the equipment they need to keep them safe?
Secretary.
Thank you, Mr. Speaker. Can I first say that in relation to all of those frontline staff who have passed away as they battle coronavirus and work so hard to protect other people who are suffering, our hearts go out to them, and he's absolutely right that we must do everything we can to protect them. I know we recently had a consultant who passed away at Kingston Hospital, where I've been treated, where both my boys were born and delivered. How important that is, how personal it is to so many of us, and we absolutely agree on the need to protect them. He will know that getting the PPE to where it needs to be is a massive international challenge that every country faces globally, from China to Germany. And we've done a huge effort to provide, for example, the ventilators which have bolstered the NHS during this incredibly difficult time. If we hadn't been able to do that, the NHS would not have been able to cope. Since the start of the outbreak, we've delivered 1 billion items of personal protective equipment, and tens of millions have been distributed via the devolved administrations. We recognise, though, that we've got to strive even harder in this incredibly difficult and competitive international environment to source the equipment. That's why we brought in my noble friend Lord Dayton, formerly Chief Executive of the London 2012 Olympics, who's been appointed to lead on our domestic efforts. We've delivered 34 million items of PPE across 38 local resilience forums. We've established the hotlines, the Royal Mail procedures, a new pilot website to make sure not only have we got the amount of PPE that we need to, but also that it can get to the most vulnerable and those on the front line who need it most.
Keir Starmer.
Can I join the sentiments of the First Secretary in relation to all of those working on the front line, and also pay tribute to all of those that have ramped up the capacity of the NHS. It's been incredible to see what's happened in the last few weeks, and I know that's been a huge effort. I do understand the challenge of getting the right equipment to the right place every time, but as the First Secretary knows, there's a significant gap between promise and delivery. And over the last few days, it's emerged that British manufacturers have got in touch with many members of the opposition, probably members across the House, saying that they offered to help produce protective equipment, but they didn't get a response from the government. Now, I do understand due diligence and that all the offers couldn't be taken up, but some of those who offered to help are now supplying to other countries. So they clearly could have supplied in this country, and something's going wrong. And there's a pattern emerging here. We were slow into lockdown, slow on testing, slow on protective equipment, and now slow to take up these offers from British firms. The Prime Minister has said this is a national effort, and he's right about that. So in that spirit, can I ask the First Minister to commit to working with the opposition to identify and take up these offers from British manufacturers for protective equipment just as soon as possible?
First Secretary.
Well, I thank the right honourable gentleman, although I don't accept his premise that we've been slow. We have been guided by the scientific advice, the Chief Scientific Advisor, the Chief Medical Officer at every step along this way. If he thinks he knows better than they do, with the benefit of hindsight, then that's his decision. But that is not the way we've proceeded, and it's not the way we will in the future. He's mentioned offers from British businesses. And it's not quite right to say that they must have been acceptable for UK standards just because they're supplying different needs in different countries abroad. But what I can reassure him on this. 8,000 businesses have offered PPE in response to the government's call, and every business receives a response. 3,000 of those 8,000 are followed up where they've got either the specification or the volume that makes it a sensible thing for the NHS to do. And he did make, I think, a sensible point about specifications and health standards. He will know from the reporting that in other countries that have distributed PPE without those high standards, they've been distributed with faults or flaws, they've had to be recalled, and health workers in those countries have had to go in isolation. So I appreciate that he wants to put pressure and scrutinise the government, but I think, and I hope he'll understand, the need to take the right decisions and to scrutinise very carefully the precious PPE that we're putting on the front line to protect our key workers.